The subcommittee will come to order. The chair will recognize himself for an opening statement. Throughout this year, various administration officials, including you, Madam Secretary, have sat in this room and repeatedly told the American people that implementation of the Affordable Care Act was on schedule. As we have seen from the disastrous rollout of healthcare.gov and documents showing that the October 1 deadline could not be met, that was false. In fact, every major promise the administration made about the ACA, from being able to keep your health plan if you like it, to being able to keep your doctor if you want to the very premise of health reform in the first place, that the Affordable Care Act would make health coverage more affordable, has proven to be wrong. My constituents have repeatedly expressed to me that they feel they were lied to by the administration about the real effects of this law. In addition, we are also learning that millions may be improperly enrolled in Medicaid as a result of the disastrous rollout, resulting in Washington yet again squandering the hard-earned dollars sent to the federal government by our constituents. Words start to lose their meaning when they're delivered by individuals who have either misled this committee or were woefully ignorant of the disastrous consequences that have unfolded since enactment of the ACA. The last time you were here, Madam Secretary, you said, quote, "I know that it isn't fair to ask the American people to take our word for it," end quote. Well, millions of Americans are being harmed by this law. My constituents do not trust the administration when it comes to the Affordable Care Act, and it is they who are suffering because of these broken promises. And I'll yield to the chairman of the full committee, Mr. Upton.
Thank you, Mr. Chairman. This committee has conducted extensive oversight of the President's health care law. Many of the administration's top health officials have testified over the last year, including the Secretary. They repeatedly looked us in the eye in the spring, summer, and fall and assured us that, in fact, everything was on track. But our oversight has produced documents showing the frantic chaos of missed deadlines and delays behind the scenes. Sadly, it seems that the administration's assurances about being ready to launch were just as empty as the President's promises that this law would mean lower costs while allowing Americans to keep the coverage and doctors that they have and like. And millions of Americans are now enduring the harsh reality of canceled plans, the burden of finding a new doctor, and the financial strain of higher premiums set to shock family budgets. Far too many Americans who were happy and satisfied with their health care coverage on January 1st of this year have had their worlds turned upside down as we approach January 1st of 2014. This is a matter of trust. It is time for the administration to be honest with folks like Mary Swanson in Kalamazoo, Michigan, my constituent, who along with her husband has lost a self-described excellent plan. No more false promises, no more political games, no more questionable testimony. It is time for transparency and the truth. And I yield the balance of my time to Dr. Murphy.
Thank you, Chairman Upton, and thank you for being here today, Secretary Sebelius. As the chairman of the Subcommittee on Oversight and Investigations, I work with my fellow members to conduct oversight of the President's health care law. We've had several people before our committee who have talked about its implementation. Some of the concerns and questions we raised in the first part of this year: increased premiums, the burden of this law on small businesses, whether the implementation was on track, and the costs have come to fruition. Documents uncovered by the O&I subcommittee show that the administration knew months before the October 1st startup of open enrollment about problems with the federally facilitated marketplace. And yet every administration official who came before us testified before the committee this year that implementation was on track. Now we are just 2 weeks from the January 1 start of coverage, and what should the American public expect? Unfortunately, the record of transparency has not improved. The administration has continued its pattern of announcing delays to the law over the holiday weekends, most recently the one-year delay of the online enrollment of the SHOP program, and fails to acknowledge problems when the writing is on the wall. In the meantime, millions have received a pink slip from their insurance plan, and others are facing unaffordable care with new higher rates. Last month, a top CMS official told the committee that 30 to 40% of the website was yet to be built. I hope you'll be able to help us provide, get some answers for us today. I hope you'll also commit today to help speed up the response to the committee's document requests. Two boxes of documents in 2 months is not a good response. Thank you.
Chair thanks the gentleman. Now recognize the ranking member of the subcommittee, Mr. Cologne, 5 minutes.
Thank you, Chairman Pitts. Let me just say that I'm sorry that you couldn't find a way to accommodate members to attend the Nelson Mandela Memorial and not miss today's important hearing. Many of the Democrats are at that memorial service today, and I know that Mr. Waxman made a reasonable request that was denied, and I wish that hadn't been the case. But in any case, we are moving forward. I listened to what my Republican colleagues just said about the Affordable Care Act, Madam Secretary, and I don't know where the reality is on their part. Sometimes I think that they're living on Mars rather than Earth. I heard consequences, things like disastrous consequences, harmed, suffering, harsh reality, world turned upside down. I mean, they should have been at my forum. I had a forum Monday night in Highland Park, which was one of my towns, on the ACA, and I heard just the opposite. People were happy because they were able to enroll. Some were Medicaid recipients who weren't eligible for Medicaid before. Many of them, were remarking about, the ability to get insurance for the first time. So, it just boggles my mind to hear these Republican comments about a world turned upside down when the reality is that the Affordable Care Act is working. People are getting insurance who didn't have it. People are getting affordable insurance with good benefits. I mean, that's the reality that I hear when I'm home, and I'm not making it up. I mean, I'll take any of them to my forum if they want to. Regardless, let me welcome you, Madam Secretary, for joining us again. I understand you've been in front of our committee more than any other, and we're grateful for your service and your valuable time. I'm eager to hear what I know is positive news about the enrollment of coverage under the ACA and the law's implementation. Republicans seem to be saying that things haven't improved. They've improved a lot, and certainly the website has improved a lot. It's really unfortunate that the Republicans continue to focus their time and efforts trying to obstruct and sabotage the ACA rather than working on a constructive way to make sure that as many Americans as possible are able to benefit from it. I'm proud of this law. And I wanted to mention a story. One of my constituents from Piscataway, New Jersey, wrote a letter to the editor of a local newspaper describing his experience with health insurance pre- and post-implementation of the health exchange. And I asked that the letter be submitted for the record, Mr. Chairman.
Without objection, so ordered.
I won't read it, but this gentleman found a plan on the exchange that cost less than the price of his previous plan. It had better coverage, better deductible, better out-of-pocket maximum, better copays, better prescription drugs. His experience demonstrates that this is a quality product that people want to sign up for. I'll leave it at that because I'm yielding now to Mr. Waxman.
Thank you very much for yielding to me. I want to echo your statement about the regrets that we have that the majority wouldn't postpone this hearing so that all members could attend the memorial for Nelson Mandela. Obviously, more Democrats feel that the reason they wanted to be there was more important than to be here. They shouldn't have had to make that choice. Madam Secretary, I want to welcome you back to our committee. Healthcare.gov is much improved since you last appeared before the committee. Millions more have applied for coverage and signed up. In fact, we just learned today that enrollment in November quadrupled over the October enrollment. All told, as of November 30th, 365,000 people have enrolled in private coverage. 1.9 million were through the process, just waiting to pick a plan, and enrollment has been speeding up each and every week. As a result, we're beginning to hear the stories of people finally getting the security and peace of mind that comes with quality health insurance. And some of these stories are very powerful. Barbara from my district recently found out that her policy was going to be canceled. And she had been rejected in the past for more affordable policies because of her back problems. In her new policy, she obtained on the exchange, her deductibles were cut in half. She'll save hundreds more on free preventive care, and her premiums will never shoot up if she has a serious health event. These success stories are happening in every state and district in the country, but you wouldn't know it from the Republican members' comments. Joanne from Florida had been uninsured and hadn't seen a doctor in years. She has repeatedly tried to enroll without success, and then this week she purchased a plan for only a few dollars a month. When that finally occurred, she burst into tears. Our exchange director in California has said that this is a common experience. I know this law is controversial, Mr. Chairman. That's because hundreds of millions of dollars opponents have spent trying to demonize the law. I think Republicans are afraid that this law is going to be popular when it's fully in effect. The public is tired of the partisanship from a divided Congress. Mr. Chairman, I want to make one request, and this will be the last statement I want to make now. I hope that the Secretary gets more respectful treatment from all members than she received at her last visit, and the minimum ought to be that she be allowed to answer questions, because last time she was interrupted over and over again. There are more Republicans here today than Democrats. We're all going to get our chance to ask questions. A lot of Democrats won't because they chose to be at the memorial service. But whoever asks a question, the Secretary should be able to answer her questions and not be rudely interrupted and not have the cheap shots she had to endure last time.
Chair, thanks, gentlemen. Gentlemen's time has expired. Without objection, all members' opening statements will be made part of the record. On our panel today, we have the Honorable Kathleen Sebelius, Secretary of the Department of Health and Human Services. Thank you again, Madam Secretary, for coming. I urge all members to use proper decorum, permit her to respond to the questions. But we only have so many minutes. I understand members will be trying to get as many questions in as they possibly can, and we'll try to operate the gavel strictly and fairly. But, Madam Secretary, thank you for coming. You'll have 5 minutes to summarize your testimony. Your written testimony will be placed in the record. So at this time, the Chair recognizes the Honorable Secretary Sebelius. 5 minutes.
Well, thank you, Chairman Upton and Ranking Member Waxman, Mr. Pitts, Mr. Pallone, members of the committee. Since I was last here on October 30th, our team has been working around the clock to improve healthcare.gov. We committed to making the site work smoothly for the vast majority of users by the end of November. And after several hundred software fixes and hardware upgrades, we've achieved this first benchmark. While there's still more work to do, we've made great progress. Healthcare.gov is working faster, responding more quickly, and we're able to handle larger volumes of concurrent users. Pages that once took 8 seconds to load are now responding in under a second. The site's error rate, which once topped 6%, has been driven down to below 1%. The system has more redundancy and stability, and we can now handle 50,000 simultaneous users and more than 800,000 daily visitors. Now, as more Americans give healthcare.gov a second look, they're finding the experience is night and day compared to where we were back in October. And they're responding by shopping for plans and enrolling in greater numbers. As Mr. Waxman has said, more than 4 times as many enrolled in the federal marketplace in November as enrolled in October. In the first 2 months, nearly 1.2 million Americans either selected a marketplace plan or received a Medicaid or CHIP eligibility determination, with nearly 365,000 people selecting a plan and 803,000 receiving a determination. An additional 1.9 million people have made it through the application and determination but have not yet selected a plan. And we expect that as more folks talk things over with their families and learn about their new options, more will enroll. To those who have been frustrated with the experience so far, we are asking you to come back. It's now easier than ever to shop for plans and enroll online, over the phone, in paper, in person, or directly through an issuer or agent. More than 5 million Americans have dialed into our call center in the first 2 months. 450,000 have received assistance from more than 19,000 trained assisters. And in the first week of December alone, healthcare.gov received nearly 5 million visits. Open enrollment, for health insurance continues for 3.5 more months, so there is still time. To put this in perspective, most private insurance plans offer open enrollment for only a few weeks. Now, we continue to be relentless in our efforts to improve healthcare.gov, and we're committed to learning, adapting, improving, and acting on the feedback we receive from consumers and issuers alike. As I told this committee at the end of October, the initial launch of healthcare.gov was flawed, frustrating, and unacceptable. And I believe strongly in accountability and our obligations as public servants to be good stewards of taxpayer dollars. Now that the website is working more smoothly, I've determined it's the right time to begin a process of better understanding the structural and managerial policies that led to the flawed launch, so we can take action and avoid these problems in the future. And today I'm announcing some initial steps I've taken. I've asked our Inspector General, Dan Levinson, to investigate the development of healthcare.gov, including contractor acquisition, the overall management of the project, and performance and payment of our contractors. I've asked CMS Administrator Marilyn Tavner to create a new position of Chief Risk Officer at the Centers for Medicare and Medicaid Services and to expedite the search and hiring. This will be a full-time employee charged with assessing risk management practices and developing strategies to minimize those risks. And let me be specific. I will instruct this officer to look at IT and contracting management practices, starting with healthcare.gov, and the risk factors that impeded a successful launch. I'll ask for an initial report in the first 60 days with recommendations on how we can mitigate risk as we move forward. And I've instructed CMS to update and expand their employee training. They'll be required to adopt best practices for contractor and procurement management, rules and procedures, including internal communications and processes. These actions build on reforms we've already made, which have led to significant improvements in the website. It includes the addition of Jeff Zients as a management expert and consultant to Administrator Tavner and me, selecting QSSI as the systems integrator, and changing the day-to-day CMS management of healthcare.gov. Fixing a flawed website has proven challenging, but it's nothing compared to the challenges that American families face every day, particularly those families who don't yet have health coverage. Families who are one medical bill away from bankruptcy, one diagnosis away from not being able to afford their mortgage or their rent. And these efforts are about them. Before the Affordable Care Act, as many as 14,000 of our neighbors were losing their coverage each and every day. The market operated inefficiently. We as a nation paid more and got lower health results. Today, healthcare cost growth has been driven down to the lowest levels in 50 years, and millions of Americans are already benefiting from new rights and consumer protections. With the new marketplace, choice and competition among private market plans is now available to millions of Americans. But our work is not done until every eligible American has the opportunity to access affordable coverage. Thank you, Mr. Chairman.
Chair, thanks, gentlelady. Pardon me. I'll begin questioning, recognize myself 5 minutes for that purpose. Madam Secretary, based on current trends, it's likely that more individuals will have lost coverage on January 1 than will have gained it under the law. HHS released data this morning stating that approximately 364,000 Americans have selected a plan through a state or federal exchange. Is that correct?
Yes, sir.
Of these 364,000 Americans, do you know how many of those individuals will actually have coverage in effect on January 1, 2014?
Sir, once they pay their premium, they'll have coverage in effect.
So you don't know. These are the ones who've just selected a plan but haven't paid their first payment on their premium.
Some may have paid, some may not. We're giving you the enrollment numbers.
Do you even, this is a critical statistic, it's clear HHS knows the number of Americans who have essentially put a plan in their shopping cart. Your testimony includes data on the number of users who can use healthcare.gov simultaneously and the number of website hits. However, this most critical statistic, the number of Americans who will actually have coverage effective January 1, do you have an estimate?
Sir, I think 365,000 through the end of November have enrolled in coverage, and we are dealing with the issuers to confirm their actual payment.
And would you define enrollment? Define what you mean by enrollment.
We are giving you the numbers of individuals who have chosen a plan.
But not actually paid their first
That's
premium
correct.
or received
Through
a
the
card.
end of November, yes.
In a-
Payment isn't due, as you know, sir, until mid-December in order to be fully covered. So we don't have those numbers, and I think most Americans probably will not pay until their money is owed.
So you can't guarantee the actual number of constituents who have coverage that they...
Not until they pay their premium.
In October, the AP reported that a September 5th memo sent to you listed monthly enrollment targets for the exchanges, and this memo indicates that your target enrollment number for the end of December is 3.3 million. Based on HHS's release this morning, your department is more than 3 million off their target number. Isn't that correct?
Through the end of November, that is correct, sir.
Some news reports have indicated that as many as 5.6 million individuals have had their policy canceled. Isn't it the case that on January 1, more Americans will have their coverage canceled than will have enrolled in an exchange?
Well, sir, I don't know where the 5 million number comes from. I know people have been told that their health plan doesn't necessarily match the ACA compliant plans. They are not in a grandfathered plan, and a number of those individuals have already re-enlisted and enrolled in plans. So losing coverage and being notified that the plan that they had doesn't exist anymore are two very different things.
Now, much like the millions of cancellations in the individual market, the Affordable Care Act requires group coverage to also comply with ACA standards, and many of these plans could be canceled next year as well. Madam Secretary, the issue with the canceled plans and the President's broken promise that if you like it, you can keep it, this is because some of those individual plans did not comply with the health care law's 2014 requirements, correct?
That is true, sir, or they did not stay in a grandfathered plan. What the law said from the outset is if insurers left the plan in place that an individual had in March of 2010, and there are millions of Americans who are in those grandfathered plans, that the plan stayed in effect through the implementation of the Affordable Care Act.
Now, what about small group market plans used by small businesses and their employees? Don't these have to comply with the ACA standards?
In the same way, if the grandfathered plan stayed in effect, they could still be in effect. If not, the consumer protections that are available through the Affordable Care Act would come into compliance.
Could some small group plans be canceled because they do not comply with the ACA?
Yes, sir. And again, insurers cancel plans each and every year. They change plans, they change networks. That's part of the market strategy.
Madam Secretary, before passage of the health care law, President Obama routinely promised that the average family would save over $2,000 on their premiums. Would you agree today that this simply is not true? Every family will see premium decreases. Some will see increases. Yes?
Well, Mr. Pitts, I think that the President talked about health care costs going down for Americans. I think that we have adequately documented that health care costs indeed have gone down based on the trajectory that we would have seen absent the Affordable Care Act. Underlying health costs are rising at the slowest rate in 50 years. Medicare costs have risen at the slowest rate. Medicaid costs have actually come down per capita throughout the country, and private insurance rates are rising at the lowest level that they have in decades. So Americans are seeing a very different cost trajectory than they would have absent the passage of the Affordable Care Act.
My time has expired. Thank you, Madam Secretary, for your responses. Chair now recognizes the ranking member, Mr. Pallone, 5 minutes for questions.
Thank you, Mr. Chairman. And again, Madam Secretary, I don't want to keep beating a dead horse here, but you know, this whole idea that that we hear from the Republicans that the world's turned upside down and this is ACA is a disaster. It's just the opposite. I mean, as you point out, healthcare costs, you know, are going down. Rates are rising at a less of a level. You know, this whole idea of you know, the president saying if you like it, you could keep it. I mean, the president didn't say that if you had a lousy health insurance policy that didn't cover everything, that he was suggesting that you know, insurance companies continue to sell it and therefore you buy it. I mean, I was at the Rules Committee the other day when the President issued his executive order, and I had one of my colleagues from Florida, one of my Republicans colleagues, talk about how his constituents should have the freedom, should use the word freedom, to keep his or her health plan that costs $60 a month. And I asked, well, what is this health plan? It didn't include hospitalization. I don't think the President meant that you should have the freedom to keep a health insurance plan that didn't include hospitalization. I mean, if you want it, his executive order says you can do it. But I think it's absurd to keep arguing over these lousy skeletal plans. In any case, the reality is that enrollment is accelerating, and I wanted to ask you about enrollment. The numbers released today are impressive, and I wanted to get some broader context from you on how enrollment is progressing. We always expected enrollment to be slow in the early months, and that's what happened in Massachusetts when they implemented the health care reform. In the first month, only 0.03% of people in Massachusetts who ultimately signed up actually enrolled. But the clear trend in the report released today and the reports from the states is that enrollment is surging. In November, there were 4 times more enrollments in private plans than in October. More than 1.2 million enrolled in private plans that were found eligible for Medicaid, and more than 1.9 million people are eligible for marketplace coverage and poised to enroll as soon as they select a plan. 3.7 million have applied for coverage. But the most important fact is the trend. The pace of enrollments at the end of the month was double the pace at the start of the month, and that trend appears to be continuing. Press reports have indicated that more people signed up for private coverage through the federal marketplace on November 30th and December 1st than signed up for all of October. Another press report noted that more people selected a plan in the first week of December than selected one in the whole of November. These are exciting signs. So just given the technical issues we've had and the corresponding delays in much of the outreach campaigns, how would you measure the progress at this point in terms of enrollment?
Well, Mr. Pallone, I don't think there's any question that the flawed launch of the website put a damper on people's enthusiasm about early sign-up. We had a lot of visitors early on who got very frustrated and have not re-engaged. We have been inviting them back to use a newly improved site, and we're seeing some very, very positive trends in that direction. So I don't want to minimize the dampening effect that the flawed technology had, not just on the federal website, but I think on the news reports also, I think, dampened enthusiasm at the state level. It was hard for California, for instance, to assure people that their site was fine while there was a lot of news day in and day out about the flawed site. Having said that, we're seeing very, very positive trends. We're seeing a lot of people re-engage, and it's about not only just the numbers of individuals, but at the end of the day, hopefully getting the right mix of individuals. And we know that a lot of younger Americans are very tech savvy, want a fully functioning, easy to operate site, and so getting healthcare.gov up and running correctly also helps with some of those targeted numbers.
I appreciate that. Let me just say, I only got 50 seconds here. At my forum, as I said, which was very successful in Highland Park, and people were happy with what we were doing the other night, they were particularly pleased that you had that option where you didn't have to, you know, basically provide all your information, but could comparison shop without actually enrolling. I thought that was very good. And still, do encourage people to use alternatives. I know you're right. A lot of people like to use the website. But I know there were a lot of people at my forum who were, you know, calling the 800 number, going to community health centers. And also, we had some insurance agents and brokers there. And I think that, I think that we should encourage that as well as alternatives.
We have been conducting some pilots with a large number of insureds in key states. I think they have gone extremely well. We are encouraging insurance companies to have their agents and brokers directly enroll, and I think that experience has been very productive, and we're working closely with them on the kind of technology fixes that they would find most effective.
Thank you. Thank you, Mr. Chairman.
Thank you, Madam Secretary. Chair now recognizes the Chairman of the full committee, Mr. Upton, 5 minutes for question.
Well, thank you, Mr. Chairman. So the goal was to enroll 7 million Americans by the end of March. 365,000 folks enrolled through the end of November. Premiums are due beginning mid-December. I wonder, Madam Secretary, if you could tell us after Christmas, somewhere between Christmas and New Year's, as to how many people actually do pay the premium that is due. If you could share that number during the Christmas break with us. Would that be possible if you're going to know mid-December?
Chairman Upton, the deadline to enroll is the 23rd. The deadline to pay is the end of the year, so we will not have a number until
the first of the year. Can you let us know that first week as to how many people actually pay?
I'll let you know as soon as we have the number, sir.
You indicated to Mr. Pallone that, in fact, the launch was flawed. Knowing what you know today, do you wish, in fact, that you had delayed the launch beyond October 1st?
Well, I certainly wish we could have saved millions of people a very frustrating experience and had a smoother technology launch. I acted on the best information that I had, and going forward, I think that having an 8-week delay in a fully functioning site is enormously frustrating and to millions of Americans and their families. Having said that, I think there are millions of people who are going to begin receiving health coverage that they never had January 1st and into the new year. And so on balance, I am not sure what the right answer is. The law's benefits went into effect January 1st. People needed some time to sort out options. We clearly put a dent in that time, but there are going to be millions of Americans with new health coverage, and that will continue on into the new year.
So you would have, knowing what you know today, you would have started the launch October 1st?
I would have probably done a slower launch, maybe with fewer people, and done some additional beta testing, which is part of what has happened, frankly, in the early months of the launch to identify what problems we had.
Let me go a little deeper. So what grade, if you could give yourself, or not you, but the grading of the launch from A to E or incomplete, what would you give the?
Mr. Chairman, I've already said that I think the launch was flawed and failed and frustrating for millions of people, unacceptable. We want to both figure out exactly the chain of events, what went wrong, which is why I've asked the Inspector General to help do this investigation. We've made some changes, and what we're doing is moving forward. We want to make sure that the millions of people who are eager for affordable health coverage have that opportunity before March 31st.
So you announced the IG investigation yesterday. Do you wish that you had started that maybe this summer, asking some tough questions in terms of where things were, knowing what you knew back then?
I didn't have cause to ask the IG to be involved last summer. No, sir.
The day after Thanksgiving, the administration announced that states would be permitted to use incomplete enrollment information to sign people up for Medicaid. Is it possible that by using incomplete enrollment information, states could be enrolling folks, the most vulnerable, by the way, for Medicaid who are not actually eligible?
Sir, we are working very closely with states around Medicaid eligibility, making determinations based on state-specific laws, which they have an opportunity to sign off on. So when someone presents at the website and we review their eligibility criteria based on the law of Michigan, we determine preliminary eligibility and send that file to the state. At the same time, the state is doing the same thing for people from Michigan who may come to the state Medicaid office thinking that they're Medicaid eligible and are determined to be marketplace eligible. They are returning files to us.
But the information is incomplete, is it not?
Sir, I'm not sure what you're referring to. We are gathering data and information and eligibility, and again, the state makes the determination based on their state law and based on the information that we have
So
collected.
are income and residency requirements part of that information that has to be verified?
I'm sorry, incoming,
Income and residency.
yes, sir. They,
Okay.
the state, again, makes the final Medicaid determination. We make the preliminary determination and send an individual to the state. If the state doesn't confirm that they meet those requirements, they will not enroll the individual. We have now, as of last night, again, got the systems automated, so these files will be sent automated, but we're also sending what we call flat paper files with full information to the states and working one at a time with states, particularly those states like Michigan, which has expanded Medicaid for their population, to make sure that the data is verified. But the state makes the final Medicaid determination, not the federal government.
Thank you, Madam Secretary. The chair now recognizes the ranking member of the full committee, Mr. Waxman. 5 minutes for questions.
Thank you very much, Mr. Chairman. I know that there's a lot of politics around this issue, and I certainly understand that changing to a system that's more fair and stable for every American, not just a few, but every American, it's not easy. But all of this is exacerbated by wild propagandist, politicized statements that have been made, even today. The chairman said more people will have lost their coverage than will get coverage. Well, that absolutely cannot be true. It is not true. The Congressional Budget Office, which is not Democratic or Republican, it's nonpartisan, they estimated that 7 million people will sign up for health insurance in the first year, and that 25 million people will be newly insured in 2016. That's really a major accomplishment. Now, we hear Republicans saying more people are losing their policy, but who are those people? We hear estimates that 80 million people will lose their insurance. When you look at that statement, they're saying that people who have a change in their policy have lost it. For example, when they get free preventive services now covered, oh, that means they're losing the policy they had. Or if young adults can stay on that policy up to age 26, Republicans are saying, oh, see, they're losing that policy. Well, that doesn't make sense unless you're trying to exaggerate numbers. There are some small businesses in this country who have offered their employees skimpy plans, and now they're being told they've got to have minimum standards in those plans. So they're complaining a lot because they're going to have to provide decent, quality, reliable insurance. And a lot of them are helping fuel this argument. So to say that 80 to 100 million people may lose their insurance is absolutely crazy. It's just not true. And especially galling to some of us when we hear Republicans so saddened by people losing their insurance, when we recognize that they want a status quo, which means repeal the Affordable Care Act, where we had 50 million people uninsured. That didn't bother them. So I just think that we ought to put this in perspective, Madam Secretary. This is not about this law, and it's not sincerely concerned for the uninsured. It's just a constant political attack. The Republicans did not want to work with the Democrats. They didn't want to work with the president. If this bill has problems, let's work together to fix them. Not talk about how it's no good, it's all terrible. Because I'm hearing from a lot of people, and I think the headline in the New York Times captured this. The article was titled, "Amid the Uproar Over Health Law, Voices of Quiet Optimism and Relief." There are voices like Stephanie from Lansdowne, Pennsylvania, who had frustrating experience trying to submit her application for the first 2 months. Then after visiting a navigator at the local library, she signed up for a policy that will cost $113 a month with no deductible. And what she said is, I'm one of the people whose plans were canceled, and signing up this time was just the easiest thing in the world. They're the voices of Ellen and Meredith from San Diego. In 2012, they lost their coverage because they no longer lived in the planned service area. When they applied for new coverage, Ellen was denied because of carpal tunnel syndrome. Now they have a plan through the exchange, $142 a month instead of a $1,300 per month they were paying before. They have a higher deductible than their old plan, but lower copays. And here's what they described their feelings. We felt we didn't have to panic or worry. If not for the Affordable Care Act, our ability to get insurance would be very limited, if we could get it at all. Madam Secretary, you've traveled around the country talking to people about this law. Do you think most people look at this as a political issue, or are they willing to put politics aside and look at the plans being offered and make the decisions of what is best for their family?
Well, Mr. Waxman, what I find is a lot of people are eager for information. They are confused by what they read and hear. And frankly, the launch didn't help that. But as people understand their options and choices, I find that there is enormous enthusiasm, often huge relief. A lot of individuals who received the notice of a cancellation are unlocked from a policy choice that they did not feel was good for them or their families. They were kind of locked into a plan. And I talk to people every day who now have 40 or 50 choices, a range of marketplace plans, the option to pick and choose. That isn't to say that there aren't some individuals who would have preferred to stay in their plans, which is why I think the President decided on the transition policy in the marketplace. But a lot of individuals
they didn't know what they had offered to them
cancellation notices
on the exchange.
are thrilled with the choices that are now available to them.
Thank you, Madam Secretary. Chair now recognize the Vice Chair of the full committee, Ms. Blackburn, 5 minutes for questions.
Thank you, Madam Secretary. I want to talk with you about data security and privacy. First up, I know you've seen the USA Today story about people in California having their information released to insurance agents, and this all happened after they had gone to the exchange. We're hearing from other states that people are having that same experience with federal exchanges. So have you talked with the California exchange about releasing that information, may help them to realize that this is inappropriate to release that information?
Well, I don't think there's any question that there is an issue about releasing anybody's personal health information, as was done in California, and there have been certainly conversations about that. As you know, we don't run the California exchange. That's no excuse. Privacy and security are hugely important.
Okay. How is the information being released? Who is releasing it? Who all has access to that? And when it is released, are people paying for that information, and who gets the proceeds from the sale if you are selling that information?
I'm not sure. Are you talking about the California specific incident?
I'm talking about any of these exchanges where people are getting...
To my knowledge, the California incident is an isolated case. We have no information. There's certainly no information about anybody at the federal marketplace for the 36 states.
We're all getting some questions.
Well, there is no information released, and actually we don't store personally identifiable information on the hub.
Will you help us look into this and get to the bottom of it? Because people are getting phone calls, and that means their information is being released. Now, if somebody is benefiting, and if that is being sold, or if there is some kind of transaction on that, we need to know that, Madam Secretary. Let's go on and talk about cost.
But I would suggest, Congresswoman, that the fact that they're getting phone calls also may be that they are customers of an insurance company who is contacting them because their policy may be up for renewal.
No,
those calls are underway.
I don't think that is quite the case. But let's go on and talk about cost. $600 million is what we know has been spent on the site so far. I'm referencing Washington Post on that. How much money in total has been spent? We're still waiting for the answer to that question from you. We'd like to know how much you have obligated since October 1 for the cleanup of this exchange. How much money do you anticipate obligating through March of 2014? And since you're going to have the IG do an investigation of the contracting, are you going to make these contractors pay this taxpayer money back?
Congresswoman, to date, through the end of October, and I'm giving you the cleanest audited numbers that we have obligated $677 million for the total IT costs and have outlaid $319 million of that 677. Some of that includes work clearly in the month of October. We will give you regular updates as we have newly audited numbers. I have asked the IG to become involved because I think it's very appropriate to look at all aspects of not only the management practices, but the contractor expenditures, the specs in the contract, the payment issues, and I will act based on his recommendation.
Okay, so $677 million is what you have obligated through the end of October.
That's correct.
Of this year.
That's correct.
Okay, so would you give us the additional?
Through the end of October, yes, that's the obligated amount. We have spent $319 million of that 677 through the end of October.
We're going to continue to watch that cost number very closely. Delays. It seems like every holiday brings another delay. So what should we expect for Christmas and New Year? We've had a total of 13 administrative delays to major aspects of the law. And it seems like whether it's July 4th or any of the holidays, Thanksgiving, we get a delay. So what are we looking at for Christmas Eve and Christmas and New Year's Eve and New Year's Day?
Well, Congresswoman, I would say that we have extended the deadline for enrollees from the middle of December until the 23rd, recognizing that people need some extra time over the holidays to
in the future, what do we expect?
They don't have to pay until the end of December in order to be fully enrolled, and we're working with insurers to make sure there's a smoother transition into the new year.
Yield back.
Thank you, Madam Secretary. Now yield to the Ranking Member Emeritus, Mr. Dingell. 5 minutes for questions.
Mr. Chairman, I thank you for your courtesy and for holding this important hearing. Madam Secretary, welcome and thank you for being here. As we all know, the Secretary is the famous daughter of a former member of this committee, an outstanding member from Ohio. Madam Secretary, we continue to hear nothing but scare tactics from the other side of the aisle. Rather than encouraging people to sign up for health insurance, doubt is being created where none exists or should. I am first to admit that the implementation of the law has not gone as smoothly as I would have liked, but that is in no small part due to the intransigence of many of my colleagues who have deliberately thrown wrenches in the gears at every opportunity. Moreover, my constituents continue to tell me about the benefit ACA continues to bring them. And I'd like to share a few letters I received recently, and I ask unanimous consent that they be put in the record. One of my constituents wrote as follows: I find it absurd, embarrassing, and an enormous waste of time, money, and human capital to see the tactics being used in Washington right now to defund the Affordable Care Act. As an individual who has a sibling with MS, a father with lung cancer, and a sister with a high-risk pregnancy, I can say with absolute personal authority that the Affordable Care Act will help and is critical to the welfare of families like mine. Another constituent wrote, quote, I have registered with healthcare.gov so that I could study and compare premium prices that I'm currently paying for my 60-plus employees in Ohio and Michigan. I am extremely pleased that even gold coverage plans are half of what we're paying now. There are 72 gold plans being offered. Now that's competition. So let's stop playing politics, look past the spin, and realize what tremendous good ACA has already accomplished for the American people, and what more it can do if we'll get together to make it as successful as it could be. Secretary, Madam Secretary, I'd like to begin by asking you a few questions about fixes to the website. Madam Secretary, is it correct that the error rate on healthcare.gov is under 1%, yes or no?
Yes, sir.
Madam Secretary, in capacity has increased to allow 50,000 concurrent users and more than 800,000 visitors daily, yes or no?
800,000 a minimum a day could come on this.
Now, as the website has improved, we've also seen an increase in the number of enrollments through the website. Today, we got more good news about enrollments. Question, is it correct that 258,000 people selected a plan through both federal and state marketplaces in November, bringing the overall enrollment number to 364,000?
Yes, sir. 365,000.
Now, Madam Secretary, and over 1.5 million people have been determined eligible for Medicaid, yes or no?
About 800,000 Medicaid eligibilities have been determined.
Thank you, Madam Secretary. Are you confident that enrollment will continue to increase quickly in the coming weeks and months, yes or no?
We are seeing a very positive trend, about 4 times as many people enrolled in the federal marketplace in November as opposed to October, and we're seeing an upward trend in December. Yes, sir.
People like, Madam Secretary, people like my constituents I mentioned earlier are seeing reduced costs when purchasing insurance through the marketplace. Is it correct that recent RAND report found that premium tax credits will reduce out-of-pocket costs for average marketplace participants by 35%, yes or no?
Well, I think, sir, if people are eligible for subsidies, they will see a significant decrease over the common
I'm
plan,
running out of time.
comparable plan.
I'm running out of time, so you got to give me yes or no. And did the CBO project that 8 in 10 Americans who obtain coverage through Marketplace will be eligible for assistance to make their coverage more affordable, yes or no?
I think the preliminary estimates were that is what the uninsured population certainly look like, yes.
So ACA also benefits people who don't purchase their health insurance through the new marketplaces. Now, Madam Secretary, is it correct that thanks to ACA, 3.1 million young Americans, adults, have been able to stay on their parents' plan, yes or no?
Yes, sir.
Now, Madam Secretary, and 7.3 million seniors have saved over $8.9 billion on their prescription drug costs thanks to provisions in ACA that closed the Medicare Part D donut hole, and that donut hole will be totally closed in the year 2020.
Yes, sir.
Gentleman's time has expired.
You have been very courteous, and I thank you, Mr.
Chair, thanks, gentlemen. Now recognize the Chair Emeritus of the full committee, Mr. Barton, 5 minutes for questions.
Thank you, Mr. Chairman. Before I ask my questions, first of all, Merry Christmas. And who was your father who served on the committee from Ohio?
John Gilligan from Ohio.
John Gilligan. See, I wasn't there then, but I'm.
But you may have served with my father-in-law, Keith Sebelius. So we had.
I just wondered,
on
just
both
on a
sides.
personal issue. Well, let me get to the unfun part. Let's go to the questions. Mr. Henry Chow of CMS, when he was here several weeks ago, in response to a question, Congressman Gardner of Colorado made a statement that 40% of the computing system hadn't even been built yet. That all what he called the back end hadn't been built, which I'd assume would be the accounts payable and accounts receivable and income verification and things like that. Could you tell us what's being done to try to get that ready by January the 1st, since almost half the system, according to Mr. Chow, hadn't even been built yet?
Congressman, I'm not exactly sure what Mr. Chow was referring to, but I can certainly tell you where we are in the build. I think the emphasis was getting the consumer-facing portion ready for October 1st. As you know, that didn't go so well. The financial management system, which is getting the insurance companies their money for accelerated tax credits and for cost sharing, is due to go into effect in mid-January. There are also some other pieces of the puzzle, not income verification. That's done as part of the application at the very front end in order to qualify someone. So that's all built.
Well, do you agree with Mr. Chow that a large part of the system hasn't been put together yet? And if so, aren't you concerned about that?
Well, it's in the process currently of being put together. The income issues, again, I want to clarify for the committee that because it's been a bit of a misunderstanding, accelerated tax credits and cost sharing don't go to consumers, they go to companies.
You're
dealing
missing
with 200 to 300 companies, and we have a system that we've announced working with companies where they will be paid in a timely fashion.
Well, I don't want to beat a dead horse, but we all agree that the website to try to enroll people has not worked very well, to be as polite as possible. Now, that's the easy part. So now we're down to, in January, there are lots of people that think they're going to have insurance that don't have it now. And the part of the system that when they go to the doctor or to the hospital, and they give them their new insurance card, that they check to see if they're covered and what the coverage is, that's not there. And there's no system there to pay people. There's no system there to determine whether this doctor or this hospital is eligible. And you still want to get this thing started on January the 1st?
Congressman, I think that is not an accurate statement. We certainly have a plan, and we have vetted it and discussed it with insurers that they are very comfortable with to get them their reimbursement.
They were also very comfortable that October the 1st was going to work. And
sir, this is people will be enrolled. That system is in place. That's what the application is about.
I predict we'll have you back here in mid-January or February talking about this problem.
This is reimbursing insurance companies. At the end of the day, it has nothing to do with enrollment. Enrollment will.
I'm not saying it does have anything to do with enrollment. Let me go to my second.
When people go to the doctor and go to the hospital, they will have a card. They will be enrolled.
I've got a minute left. I've got one more question. I want to put the slide up that says on Section 1401. Under the law, Section 1401 says that if you go through a state exchange to get insurance under what we call Obamacare, that you're eligible for a subsidy. If you don't go through that state exchange, you're not eligible for a subsidy. Now, IRS has ruled that we don't have to obey the law. We're going to give the subsidies whether we go through the state exchanges or not. What's HHS position on obeying the law and doing what the law says, which would mean almost everybody who signs up for Obamacare is not eligible for a subsidy because they're not going through the state exchanges?
Sir, we have deferred to our partners at the Justice Department and at the Treasury for.
Now, what's your position? What's the HHS position?
We have deferred to our partners. This is in litigation, as you know, right now. We feel that the
I'm asking what your position
covers,
is. You're not worried about obeying the law.
We feel that the law covers both state and federal exchanges.
That's not what it says,
recommendation of the
Madam
Justice
Secretary.
Department.
Chair thanks the gentleman. Thank you, Madam Secretary, and recognize the gentleman from Utah, Mr. Matheson, 5 minutes for questions.
Well, thank you, Mr. Chairman, and Madam Secretary, thanks for joining us today. We've already had one hearing on the website before now. We're all aware of some of the challenges of the rollout. You know, when you come before a committee, there's all kinds of other topics I'd like to raise with you, issues about the health insurance tax or difficulties some providers are having with meaningful use stage 2, but I think this hearing's more about rollout of the website, and so I'll focus on that in my questions today. I think we all know that and you've acknowledged the criticism of the website when it was coming out. Let me ask you a question. As we go forward, have you developed sort of a master list of the issues that still need to be resolved, or the issues you're trying to anticipate as we move forward from today?
We are doing that on an updated basis, yes, sir, both on the policy side and on the technology and user side.
So that's not a static list. That's an evolving list as time
Yes,
goes
sir.
on. You see other things. Okay. Is it possible for that list to be shared with the committee, or is that something we could see on this committee? Or?
As you say, it's not a static
Right.
list. It's a dynamic list, and it's basically anticipating what the next policy choices are, what happens. You know, we're happy to give the committee an outline, but I don't think there's any great secret to it.
Okay. You know, I want to talk about some of the issues that is addressed with the 834 form, where I know the error rate's been dropping and enrollment's increasing at the same time, so you kind of have these lines going in opposite directions, both favorable directions. But that being said, do you have a sense of how many enrollees may have 834 errors that need to be addressed?
What I can tell you, Congressman, is we know in the early days there were serious number of errors, and we are in the process of actually hand matching individuals with insurance companies. They have added some important personnel to the tech team so that they are helping to identify where the bottlenecks were and fixes. We are seeing a vastly improved system, but we want to go back and make sure that everyone who thinks they are enrolled in the early days actually is matched with a company, and that the company folks are matched on our end, and that process is very much underway. And a lot of fixes have been added in October and November for the 834s.
And in terms of that declining error rate, how do you calculate that? Is that an average of all the plans, or is that a snapshot of a subset as you go forward? How do you go about figuring that out?
Well, it isn't really plans. It's looking at the site and determining the errors that occur along the way. So pages that came up, or people got locked out or dumped out or wouldn't accept an ID. And that's really been the roadmap to what needed to be fixed. And that has been a very dynamic process that's still underway.
Right. And following up a little bit on what Mr. Barton was asking you about some of the issues more on the back end, you know, I guess CBO's predicted about 6 million individuals are potentially going to seek subsidies. And for folks, not everyone's going to start up January 1. I understand the open enrollment period goes beyond them. But as these first month premiums for the folks starting January 1 are coming up, are we going to have this system in place where these subsidies and these payments at the back, is the back end system going to be structured in a way where the subsidy payments are going to be able to be made for this first month of participation?
Yes, sir. They will be made, and they'll be made in a timely fashion, and they're made in a way that the insurers have agreed that works for them. So as the full system is being automated, there is a step in the early months to make sure that the payment to insurers, again, an individual will be enrolled, qualified for a subsidy. The insurer will accept a premium. At that point, that individual is insured and has full benefits. Starting in mid-January, the insurance companies then receive reimbursement for the tax credit and cost sharing if it's eligible for individuals. So it's a two-step process.
Right.
One affects the individual. The second affects the companies, 200 to 300 companies total. We have a system that, again, has been signed off by them in terms of getting them paid in a timely fashion, and we will absolutely do that.
And the subsidies go directly to the insurance companies?
Yes, sir. Not to the individual.
Okay. And so when we hear about these problems with needing to build out the back end, you're saying that this particular component you've got...
Well, there's a manual workaround, I would say, for virtually everything that isn't fully automated yet. It is in place. It just will be manual until the automation is fully complete, and we've tested it and make sure it works. But in the meantime, the payment system will absolutely go forward.
Okay, thank you. I'll yield back, Mr. Chairman. Thank you.
Chair, thanks, gentlemen. Now recognize the Vice Chairman of the Subcommittee, Dr. Burgess. 5 minutes for questions.
Thank you, Mr. Chairman. Secretary, welcome back to the committee. I may not have an opportunity to go through all the things on my list. We have submitted questions for a record in the past. We've not received answers to those. So let me again encourage you to respond to previous questions and to these questions because they are important and constituents are asking us. In fact, a constituent on a telephone town hall earlier this week, single mother, earns just over the amount, so good for her. She's got a good job, works for a small employer, lost their insurance in the small group market. Now she's being hit with a premium, an unsubsidized premium for which she's not eligible for a subsidy of $1,500 a month for her and her child. I mean, when you were working through the nuts and bolts of establishing this law, did that situation come to mind? Were you concerned at all about that individual?
I'm concerned about all individuals having affordable health coverage, yes, sir.
Well, apparently she doesn't have affordable health coverage. In her opinion, she lost her employer small group market coverage.
So her employer chose to drop the coverage
because of the expense involved with that. Okay, you were here in April. I think it was April 18th. You had just received 2 weeks prior a red team discussion document from McKinsey Group. My information is that you were briefed on this report 2 weeks prior. That's what's listed on the final page of the report. Let me just play a little clip of our interaction from April. It's good. Sounds better today than it did then. Okay, that's going to take let me just tell you what we're dealing with. The study that the McKinsey Group put together dealt with the readiness of healthcare.gov. I was asking you about the readiness, and you replied that we are moving ahead. We have the federal hub on track and on time. Do you recall that exchange between the two of us?
I'm sure that exchange took place, sir.
But here's the question. 2 weeks before, you were told by the McKinsey Corporation or the McKinsey Group that, number one, they weren't allowed, they found extensive problems. They weren't allowed to change the launch date. The thing had to launch at full volume, and though no one was in charge, the completed project was a moving target. So you were aware of all of that when you came to testify to the committee in April, were you not?
Sir, I asked for the McKinsey Group to come in 6 months ahead of launch date and give us an analysis of their best advice. I was briefed on it, and we acted on their recommendations.
You were the one who commissioned the McKinsey Group report.
Pardon me?
You were the one who commissioned the McKinsey Group?
We asked for them to come in, yes,
You
sir.
yourself?
Yes, sir.
Well, again, I just have to ask you, what did you do with that information? Because you weren't being honest with us 2 weeks later when we were talking about it in committee.
Sir, I would disagree. We wanted the report 6 months out to make sure that we had independent eyes and ears, look at the readiness, look at the challenges, and we took their advice very seriously. I would tell you, sir, that their primary advice focused on the reliability of the hub. They thought that would be where the large number of problems occurred. We focused a lot of time and attention. We looked at
and may I submit that they were actually accurate in that assignment.
The hub has worked beautifully from start to finish.
Look, you've testified this morning that people cannot actually make their payment now when they go on healthcare.gov.
No, that's not accurate, sir. I said a lot of people haven't yet made their payment. The payment isn't due.
I was unable to make my payment on healthcare.gov on the federal exchange from the state of Texas, and I was told you can't make that payment. I've not known any.
You make it to an insurance company. You don't pay the federal government. We are the sign-up site, and you make the payment directly to the insurer.
December 23rd, you said if someone has worked through the process, they're going to be covered, but payment may not have been made. Is that correct?
What I said, sir, is that you have to be enrolled by the 23rd and make a payment by the end of the year in order to be fully insured.
Who is going to guarantee that the doctor that sees that patient on January 4th is actually covered for that visit?
The insurance company that, as they do today, you are enrolling in a private insurance plan.
What if
that
patient doesn't make the premium payment? You said they're covered December 23rd, but they never write the check. They never make the payment.
Then they're not covered. They are not enrolled, and at every point along the way on the website, they are told until they make the payment.
Well, are you going to make good for those doctors who see those patients the first couple of weeks of January who then have their cash flow interrupted? I'll just tell you, for practicing in a small practice, you get your cash flow interrupted for 2 or 3, 4 weeks. That's big trouble.
Well, again, if an insurance company gives an enrollment to a customer, they will make good with the provider. We tell people over and over again they are enrolled when they make a payment. We turn their name over to the insurance company.
But you
and
said
the
earlier this
insurance
morning
company deals with their new customers.
if they're enrolled by the 23rd, they're going to be covered. And
Sir, not until they pay, and that's what every step along the
do you
site
know how
says.
hard it is to actually make that payment?
Thank you,
Pull your
Madam.
billfold out and actually make the payment? Have you done that yourself?
I have not.
Well, I will
Sure.
tell you, it's almost impossible. I've never seen a business where you get to the point in the fundamental business transaction, you're going to make the payment, and you can't do it. That
Gentleman's
is a
time
flawed
expired.
system.
Thank you, Madam Secretary. Now, the Chair recognizes the gentleman from Georgia, Mr. Barrow. 5 minutes for questions.
Thank you, Mr. Chairman, and thank you, Madam Secretary, for being with us today. I'm glad there's been some progress since the last time we met, but I'm still concerned about what's going to happen when the insurance that's mandated under that goes live at the first of the year. I voted against the health care bill in large part because I thought the whole thing was just unmanageably big to begin with, and I worry that we've only seen the tip of the iceberg, but I hope I'm wrong about that. I want to ask you about other approaches toward the fundamental chore of trying to get folks enrolled in plans required under the Act. Are there other insurance plans out there that are internet-based? Aren't there other folks who are selling health insurance on internet-based exchanges?
I think some of the companies have internet sites, and I know that the e-health brokers have a variety of plans available. I can't tell you how broad-based that is, but I know a number of companies you can either sign up in person with an agent or broker or sign up online.
To what extent were efforts made to reach out to such folks to try and learn from what they're doing or to try and utilize the technology that they're already utilizing to sell health insurance on the internet?
Well, I think there was a lot of outreach and a lot of conversation about what works and what doesn't. I would suggest that this is a unique integrated product because not only is an individual identified and verified, but can qualify then for a tax credit and cost sharing based on his or her income, can be qualified for not only the federal marketplace, but Medicaid CHIP services. And in the federal website, each plan, each state offers a different number of plan, each state has a different set of Medicaid rules, and each state has a different level of benefits. So it's basically an integrated system that tries to get you to the right place so you can make a choice.
Well, are private health insurance plans that are operating their own internet-based health exchanges actually able to take advantage of the unique features of the law, the fact that you get subsidies if you're income eligible, the fact that there are specific packages that are required?
Not unless they verify that information through the hub. No one can have...
Is that being done? Can
Yes,
that be?
sir. Yes.
It is being done?
It is.
Through private insurance companies?
Yes, sir.
Who?
They don't have direct access to the hub. They come into the hub through...
I understand
EMS
that.
and-
I understand the
Well,
aspects.
Blue Cross Blue Shield and AHIP plans are doing this
The reason I
direct
ask is
enrollment all over the country now that the site is functioning.
Well, the reason I ask you is that if there are other sites, other internet-based exchanges already functioning, it seems to me that it would be a very helpful approach to have all hands on deck in trying to do
Well,
this.
I'm sorry, to clarify, they are. The e-health insurance folks are now engaged and involved, the brokers involved in that, the companies are directly involved, as well as individuals navigating on their own. So it's
Well, are you telling us that folks who would otherwise be able to get health insurance through healthcare.gov can get their insurance through a private internet-based exchange such as ehealthinsurance.com?
Well, it again has to, if they are subsidy eligible, they need to touch the hub and get that verified so that that subsidy goes forward with.
Who is the they that need to do that? The insurance companies you're dealing with,
an
or
individual
the
can
customer?
do it sitting in an office with a broker. They can do it with the e-health insurance folks. They can do it on their own. They can do it with a navigator. They can do it on the call center. So there are a whole variety of ways that individuals can do that if they are not subsidy eligible, if they make more than $46,000 as an individual or about $92,000 as a family. They can just go directly enroll in a marketplace plan with their
I recognize
insurer
that, but
looking
again,
at-
back to the point you began with, the role that healthcare.gov is supposed to provide is to try and match folks up with the subsidies as well as the products that are out there. And
That's
you're saying
correct.
that can be done, be
Yes.
done through private exchanges that exist right now. It doesn't have to be done through healthcare.gov.
again, the subsidy eligibility, which involves verification of income, verification of citizenship, verification that you are who you say you are, has to touch healthcare.gov. Other than that, the enrollment process can be done in any
But
variety.
that front door that's provided by a private internet-based exchange can communicate with folks in the back room at the government, on the government end. Is that correct?
Well, again, they do not have access to the Social Security database, to the IRS database, to the Homeland Security database. That's the piece that verifies the individual's eligibility and can move them forward. But that is being done now by agents and brokers, by the e-health folks, by a variety of people along the way.
Thank you, Mr. Chairman. My time is at the end.
Madam Secretary. The chair now recognizes the gentleman from Kentucky, Mr. Whitfield, for 5 minutes for question. I'd like to ask gentleman from Pennsylvania, Dr. Murphy, to take the chair.
Well, thank you, Mr. Chairman, and Madam Secretary, thank you for being with us. Mr. Waxman admonished us to treat you with respect, and I think that certainly we should do that, and we want to do that. But I will tell you, our very first concern is with the constituents that we represent. And some people have said that we're simply trying to put obstacles up for the successful implementation of this act. And I can tell you for myself and many others, we're here because our constituents are genuinely concerned and upset about what is going on. And a lot of it begins with the way this bill was passed. When it came to the floor, the most comprehensive change for health care in America that's ever been undertaken, no one could offer one amendment to the bill. And so there are very deep feelings about this still. And many healthcare experts today say that we're going quickly to a two-healthcare system. We're going to have one healthcare system for wealthy Americans, and then everyone else is going to be under the Affordable Care Act. And that is exactly what has happened in other countries that have gone down this path. Now, when this legislation passed, your office was given immense powers and decision-making authority. And we know that many regulations have been written. Could you tell me how many pages of regulations have been written to implement this act?
Sir, I can get you that number. I do not know.
Do you have any idea?
I don't know how many pages.
Do you have a range?
I would like to get you accurate.
I mean, is it 100 pages or would it?
Sir, I will get you information.
So you don't know?
I just told you I don't know.
Now, the president went all over the country talking about how this is going to save money, people are going to have lower premiums. And I can tell you, those of us on the Hill who've been going on the DC Health Exchange have discovered that our premiums are certainly much higher than they were. And when we talk to our constituents going on the exchanges, we're discovering that the majority of them, their premiums are much higher. And my understanding, OMB has said that the subsidy will cost the taxpayers over $1 trillion. We've been told that, I'm sorry? Will save. Well, the subsidy will cost the taxpayers $1 trillion because somebody's got to pay for it. And I would also like to ask you a question because of what is perceived as a real inequity in this system, how some people are being favored, other people are not being favored. When you go to the Rotary Club and speak, and people ask you, do you have to go onto the exchange? Does the president have to go into the exchange? Do the political appointees have to go into the exchange? And you say no. Do you think that's fair that the rest of the American people have to go under this exchange, but you and the people in the president's and the executive branch of the government do not have to go on the exchange?
Well, sir, I would tell you that the vast majority of Americans with insurance also will not be on the exchange. 177 million people
but I'm asking
have
about you.
Coverage. It is, as I said to this committee in October, illegal for me to go onto the exchange. I misspoke. slightly, because the reason it is illegal for me, which I knew, is I'm an old lady. I'm Medicare eligible. It is illegal for a company to sell me a policy because
you don't
I
have to go on the
qualify for
Medicare, though. You don't have to go on the Medicare if
I
you're
am
working
not allowed
somewhere.
to be sold a policy in the private
But
market
look,
if
all
I'm
right,
over 65.
thank you for your comments, but the bottom line is the executive branch of the government does not have to go on the exchange. Everyone else does have to go on the exchange. Now, in addition to the $1 trillion that the taxpayer is going to pick up on the subsidy, they're going to pick up another $710 billion because the president agreed that the federal government would pay more of the state Medicaid cost. And then
you know, sir, that's fully paid for in the health care law, and in fact, the CBO has estimated that it reduces the deficit.
It's fully paid for by the taxpayer dollars, by general fund dollars.
Unlike Medicare Part D, this bill was paid for.
And then let me just say this. The president said that everyone's premiums would decrease. The president said people would be able to keep their plan. The president said they would be able to keep their doctor. It's turning out that that is simply not the case. And so there is a lot of frustration, and we are upset about it. And my time's expired, so thank you.
Thank you, gentlemen. Time's expired. Ms. Schakowsky, you're recognized next for 5 minutes.
Let me clarify some things using the Dingle yes or no strategy. Is it not true that the Congressional Budget Office said that 8 out of 10 Americans who will go to the marketplace should qualify for assistance?
I think that is true.
Yes or no, is the Affordable Care Act paid for? I know you referred to that, but if you could explain that.
It is paid for, and in fact, again, the Congressional Budget Office estimates that it will reduce the deficit in the first 10 years by about $120 billion, and then over the next 10 years, reduce it closer to $1 trillion. So defunding or delaying or repealing the Affordable Care Act actually adds to the deficit.
And isn't it true that many of the people that have gotten these letters about the cancellations will be able to go to the marketplace and find something better, or at least as good?
Well, again, in the individual insurance market, which is what we're talking about, the plans change on a very rapid basis, are constantly refreshed. So having a plan cease to exist is not a novel idea. There are a significant percentage of people who will be grandfathered in, have the same plan they had in March. They don't change at all. For others, they will have choices, many of them that they never had before, both to get some assistance, financial assistance, since they don't have affordable coverage in their workplace, get some financial assistance paying for health coverage, but also be able to choose in a competitive marketplace and not be locked out because of a pre-existing condition, not pay 50% more because they're a woman, not be worried about being dropped or kicked out if they get sick down the road.
You know, we've been going by anecdote, and so I wanted to just read you a letter that I got. I'm going to contribute to the anecdote pile from Janine and Jeff. It says, since so much of the Affordable Care Act debate is focused on anecdotes instead of the many benefits, such as not denying coverage for pre-existing conditions and coverage for young adults under 26, we thought we'd share with you our positive experience with the website. Like many American families, our young adult children asked for help reviewing the options and making the health insurance decisions while they were visiting us over Thanksgiving weekend. We went to healthcare.gov, and it worked. Not only did the website work, but it was easier to navigate and faster than the websites of the private sector health insurance companies. The other good news is that our daughter Erica is pregnant with a baby due in March of 2014. Her current health insurance policy is expiring on December 31st, and were it not for the Affordable Care Act, it is unlikely that a woman who is 6 months pregnant would have been able to obtain health insurance at all. the ACA is helping her just when she needs it the most. I have two others that I'd actually like to submit for the record, positive stories that I'm getting. We are getting more and more of those stories, and I just want to say to you, Madam Secretary, I am absolutely confident that the role that you played in bringing affordable health care to millions, tens of millions of Americans will go down in history as one of the great achievements of our country throughout its entire history. And I just want to thank you for that. I understand and fully agree that the rollout was, you know, as unpleasant and as horrible as it could have been probably. But by the new year, and into the new year, we're going to find all these stories. My understanding is that 39 million people went to the either state or federal websites during November. Is that true?
I think that is accurate. We know we had, at least at the federal website, 5 million visitors in the first 6 days of December.
And what do you think that indicates?
Well, as we've seen all along, there is tremendous interest. There is now a very updated and easy-to-use anonymous shopper that will give people information before they go on and enroll. And what we're seeing is people coming back several times. This is an important decision. It's important for them and their families. And visiting the site, they're eager for information, and they're desperate, many people, for affordable health coverage that they've never had before in their lives.
Thank you. I yield back.
Gentleman leader's time has expired. Now we'll recognize the gentleman from Illinois, Mr. Shimkisser.
Thank you, Chairman. Thank you, Madam Secretary. I'm going to try to be nice and polite and kind, and these are difficult because we're very frustrated because we really want to get some of the truth out. Last Congress, you testified to me and to this committee that we double counted the $500 billion. $500 billion was counted to preserve Medicare. $500 billion was credited to pay for Obamacare. You admitted that. So you can't tell us that this is paid for when we double counted $500 billion. I just want to put that on the record. And as for the amounts of enrolled, Illinois, 1,300 have enrolled in a plan, 1,300. 20 times more have enrolled in Medicaid. And this Medicaid explosion, either that are enrolled fraudulently or enrolled through woodworking or enrolled through the new expansion, is going to kill the states. Madam Secretary, when Amazon.com records a book sold, they record a book sold based upon someone who's paid for it, not what's in their shopping cart and not what's on their wish list. So our concern is this 364,000 number is fraudulent because it's not those who have purchased plans yet. And so I would ask that when you return, that you give us actually who has purchased plans. Do you understand our frustration with that?
Sir, as you well know, we did not take over the private insurance market. People will purchase
but you are telling
from insurance
but you're
companies.
Telling us that those who just
I have told you
shop
who is enrolled.
are enrolled.
I have told you, sir, who is enrolled.
Okay, that's why we're frustrated because we just don't get the truth out of you.
This isn't Medicare, and we
Let
don't
me go
have
to my
people
next
enroll
question.
in a government plan.
Let me go to my next question. I had my phone on, and when my phone rang, I left it on because I wanted to talk to a Democrat state senator from my state of Illinois who's on the Insurance Commission. And he said, and I quote, "Mandated preventive services are laid directly on premium prices." Now, so you cannot say, as you had numerous times, that these preventative care services are, quote unquote, free of charge, can you?
They are free to the consumer, yes, sir.
They are not. There is no free lunch, Madam Secretary. If the premiums increase because of the mandated coverage based upon a state senator from the state of Illinois, a Democrat, who is in oversight of the insurance of the state of Illinois, and he says when you mandate coverage, it's rolled directly on premiums, as in premiums increase, that's paying for these services. You cannot say that these are free of charge.
Again, consumers will not have a copay or deductible, and I think that
will you admit they will have a higher
sir,
premium?
No, I do not. I think what a lot of actuaries will tell you is if you have preventive care and prevent a more costly hospital stay, cancer.
All right, I got it.
Down the line, that cost
we're just going to agree to disagree.
Lowers the premium, doesn't raise it.
It's like talking to the Republic of Korea or something. Last question.
Yeah,
Mr. Chairman,
look, you
through
have,
the
Mr.
great
Chairman,
works.
Mr. Chairman, you have to let, we said in the
I do not have.
we said we were going to let the
gentleman
Secretary
controls the
answer
time.
question.
If the Democrats want to yield some time to finish.
Yeah, I know, but you have to leave her the opportunity to answer the question.
I do not
all
have
agreed
to allow her.
Yes,
to
you did. We
answer
all
a question
agreed on
when
that at
she
the beginning.
filibusters
We're going to
the
let
whole
the
time.
Secretary
I do
answer the
not have-
question.
The gentleman will suspend. The gentleman will suspend. Give the Secretary time to answer questions. The gentleman.
Last question, Madam Secretary. Through the great work of Congressman Chris Smith, we know that 112 plans offered to congressional employees and members, only 9 offer 9 policies exclude abortion coverage, and I have his flyer that he handed out to us. Madam Secretary, you promised last time you were here that you would provide me a national list of those who cover and those who do not cover abortion and abortion services. We have yet to receive that list. Now, folks are shopping now. And I'll tell you, when we went through this last time, we received a call from my office from someone in the country who was pro-abortion, thanking me for that question because they want to know. We need that list, Madam Secretary, and if they're shopping today, we need that list today. When will you provide that?
Sir, every plan lists plan benefits, and the one plan benefit that they must list by law is abortion services. So as a shopper goes on, I would highly recommend that they look in the plan benefit section and check for the coverage they're interested in.
Last time I was here, I held up numerous policies that would not explain that. In essence, you promised to provide the list of those insurance plans. All we're asking is for you to keep your promise.
It's the summary of benefits and plans. I guess we could go on.
Will you provide us a list?
I will ask the D.C.
You promised last time.
Sir, it is on the website.
Will you promise a list? If it's on the website, can you provide us a list?
It is
Can you provide us a list?
Gentleman's time. Madam Secretary, were you able to answer the gentleman's previous question? Were you able to complete your answer? Were you able to completely answer the question that the gentleman asked prior?
I assume so.
Okay, thank you. Mr. Green of Texas, recognized for 5 minutes.
Thank you, Mr. Chairman. Madam Secretary, thank you for being here and taking time to testify. First of all, let me give a little history lesson, and I know my colleagues are upset that this bill was passed at night, the Affordable Care Act in 2010. I was here in 2003, and the prescription drug plan did also not allow amendments on the floor of the House, and I remember walking out of the front of the Capitol and seeing the sun rise from the east that morning on prescription drug plan. So we were there all night. So you can dislike the law, but you can't say because it was passed at night or that there were no amendments on the floor, you did the same thing as a majority, and that's not uncommon for comprehensive bills that we have on the floor.
Well, gentlemen,
the other issue, no, I won't yield. I only have 5 minutes. The other issue is that the reason the administration is not covered under the exchanges, any employer or employee who has employer-based insurance doesn't need to go to the exchanges. Now, members of Congress, the exception at our own doing. It was part of the bill that came from the Senate. And believe me, I disagree with a lot of the things that the Senate put in that bill. I know my ranking member and I both have some issues with the way the law is now, and we would like to change it. But the House bill, we had hours and hours of amendments in this committee. I had 30 amendments on my own, and a number of them were bipartisan that were adopted by voice vote. So our committee had plenty of time to debate this bill. We did that to prescription drug plan, too, because I was here in 2003. We had a lot of committee amendments, but not one on the floor. And we didn't have one on the floor either. But let me get to my questions. First of all, since the launch of the exchanges on October 1st and problems with healthcare.gov website are glaring and unacceptable, and I know you took responsibility for it along with the President, I'm pleased that we've seen a great deal of progress made since then. And I hope to see continued success in the area the Affordable Care Act can deliver on its promise to make coverage available and affordable to Americans who are stuck with unfair and unstable individual market healthcare, the insurance market. But that market's still available, even though in a lot of cases that's why the Affordable Care Act's needed. It was broken. what fixes are still need to be made to make the experience of purchasing health care on healthcare.gov easier for consumers? Is this an onward process that you're learning every day, I hope? Because in business, we learned every day to serve our customers.
We are definitely learning every day, Congressman. I would say since I was here last, the greatly improved anonymous shopper feature is on. We just added today the automated Medicaid transfers, recognizing that some states are not able to accept them in an automated fashion, so we will do both. We have added Cuidado de Salud, which is the Spanish version of the website experience that rolled out last week. We are in the process, as I said, of building the financial management, but each and every day we learn something from consumer experience. It is a process where each week we are adding fixes, identifying problems, and we'll continue to do that. This is a first-of-a-kind product, and we're going to continue to make the experience more smooth for consumers.
Well, and it is important for the affordable, the website to work, because in the middle of November, we had an event in Houston where we had 800 people show up on a Saturday morning, and we used paper applications. That's my next question. The 400 or so people who filled out those paper applications in that 4 hours on a Saturday morning, how are they being dealt with through the exchanges?
Well, sir, we have a number of people who use paper applications early on or PDF applications, and we are recontacting each and every one of those people, offering them either somebody to help them walk through the web experience or inviting them to do it themselves. So that is very much underway on a casework basis. We want to make sure that anybody who filled out a paper app is actually welcomed into the system and gets through the process by the 23rd if they want coverage January 1st.
Well, I think it's interesting, though, because my colleagues object to the marketplace. But, you know, the marketplace was actually a compromise in the Senate. You know, the House bill that passed did not, we had an exchange, but it was separate because we also had a public option on that exchange. So it's only market-based. And when I went on to buy our insurance, and I agree with my colleagues, my insurance have gone up like you. I'm over 65, and you rate my wife and I, we're going to pay higher premiums. We did have trouble even through the one for the members of Congress, but most of the people in our country are not going to deal with the exchange because if their employer continues to provide their coverage, they don't have to worry about this. And I can also say that I've had dozens and dozens of seniors, because of all the misinformation out there, who are confused, who have Medicare,
yes,
and say, I'm concerned about my Medicare. Well, Medicare has only been benefited by the Affordable Care Act. And again, thank you for your time. Thank you.
Gentleman's time has expired. Now I recognize myself for 5 minutes. First of all, Madam Secretary, thank you for being here. I also want to thank you for getting the mental health parity regulations done. Those are very important. You put a lot of work into it. Thank you. And there's more work we all have to do on mental health issues, and I would welcome an opportunity to meet with a number of us to talk about some of the things we need to do to help mental health in America, and I appreciate your dedication to this. I also want to thank you for this analysis. It is helpful for us to really see some breakdowns of what's taking place with regard to the states and the marketplace. I want to ask some clarifying questions, see if you know or if you can find out on this. Of those who have signed up, you have a list here of those who have signed up for Medicaid and CHIP Marketplace. Do we know how many were previously eligible for Medicaid, not those that were added on, but were previously eligible? Do we know that number?
Sir, I don't know that number, and we're trying to get those numbers at the state level. Again, we know that a number of people, even in non-expansion states, have come forward and now are presenting themselves as Medicaid eligible. But what's the old rules and what the new rules? We're getting that number from the state.
Will you be able to find out from that analysis? So we had the previous level, and now it's up to 133% of income or whatever that is in the various states. It'd be nice to know how many were previously eligible and just never signed up, and how many are newly eligible and signed up. Thank you. You can get us that information. Also, in terms of the analysis of the data, which is very important, of those who have signed up.
I'm sorry, can I interrupt you one
Yes.
second? There's actually a third category. We know that there are people who are currently enrolled in Medicaid who are sort of re-enrolling.
Yes,
so they're
yes.
not new to either category, but they actually are renewing, and
Precisely,
they're part
yes.
of that.
We'd like
so
to
we'll
know
get
that,
that
too.
three-way breakdown.
The renewals, previously eligible but didn't sign up, and newly eligible. Thank you. Also, of those who have gone to the marketplace, the federal or the state marketplace, but are not Medicaid, how many were previously uninsured but are now covered? Let me roll these out. How many were insured but had plans canceled so they're covered? Do we have that kind of information? Is that things that we're able to get?
We may be able to get some of that from the insurance companies. We would not collect that specific information, sir.
And people are talking about whether or not the policies would cost them less or more. Obviously, it's critically important to have the facts on this. Is there a way that your office, or is there anything built in where we can actually find out how many people are paying more, how many people are paying less?
Again, we'll rely on companies because we're talking about formerly insured to
So they may switch to a new
continued
plan?
insured. They may switch a plan. They may have paid something, but that's really going to be company data, not data that we would have. No one newly insured would have that comparison, so it's a...
We've heard people have different opinions, and it'd be great if we had the facts on that, so that'd be helpful. And of the demographics, when I talk to some people who are insurance brokers or agents, they're describing that many of those who are signing up are people who may have had some health problems, have seen some high costs already, and they're going to the marketplace to find some of the costs. And there's also groups who may be healthy, and they're seeing some price change there too. Obviously, if the Affordable Care Act was designed to help those sign up who were not able to afford health insurance before, or who were having difficulty because they had some illness, will we have breakdowns based upon those factors?
Again, we will be able to tell you, hopefully in the not-too-distant future, demographic breakdowns because we don't collect personal health information from anyone because there is no longer a pre-existing condition. Nobody is medically underwritten anymore, which everybody was in the individual market. We won't be able to tell you who of the population is sick or not sick.
Probably that only item is the question on the questionnaire, the federal questionnaire, which asks people if they have a condition of a disability or mental health problem or emotional problem. I guess we could look at that data. If people checked that box, that would tell us something.
For Medicaid eligibility, sir, there is I think, a question on pregnancy and a question on disability.
Yes, yes.
And those are the only two questions because that may qualify someone of a different income category for Medicaid. So those are the only two, I think, health information that is collected. But we don't have personal health information collected.
Okay. We'll need to get those facts. You had mentioned you had asked McKinsey to study the readiness of the exchanges for the October 1 launch. Did the White House encourage you to ask for this? Was this a decision you made on your own?
We made the decision going forward.
And why was that?
I think it's prudent to invite people who have not been directly involved with building a product to take a look at get their assessment on how things are going, what the problems are, and do it enough in advance that hopefully you can take their advice.
I'd love to know from you, and if you can follow up with this, what changed because of that report. Finally, let me ask this. The President said if people have suggestions to improve what's going on, he'd like to know. I'm wondering, you have been immersed in this for quite a while. Is there some recommendations you have for Congress of what we need to do to take care of some of the problems we're facing?
Well, I certainly think that we will know a lot as we complete this first year of open enrollment. I would love the opportunity to come in and discuss those with this committee and others. This is as you know, the final phase of the 3.5-year implementation that has been underway, and I would say that we know a lot about young adults that we didn't know then. We know a lot about some of the preventive care issues. As you say, mental health is going to be a part of this. So I think we will have a list to actually share with you, and we'd love to work in a bipartisan fashion to actually fix the bill. There's no question that a brand new bill, will take some amendments and hopefully move forward, but I would welcome that opportunity.
Thank you. My time has expired. Now recognize the gentleman from Florida, Ms. Castor, for 5 minutes.
Thank you, Mr. Chairman. And Secretary Sebelius, I'm very pleased to see all of the progress that's being made with healthcare.gov. Reports from consumers and recent enrollment numbers suggest that individuals using the website to obtain quality, affordable health insurance are having a much smoother and more successful experience. Thank goodness. Reading over the statistics from the new report, I was very surprised that the state of Florida is leading enrollment out of all of the states on the federally run exchanges, because we've had so many political roadblocks. There's been so much misinformation. This is good news for Floridians, and it makes me wonder, what if the website had been working great right off the bat? These would probably be doubled. So I know families and individuals have more time. We really want to push over the next few weeks, but you said they have 3.5 months?
That's correct, Congresswoman, and as you know, because you've been a key part of this, I think the assistance of not only key members of the congressional delegation throughout Florida, but mayors, civic leaders, healthcare providers, navigators, assisters stepping up and really getting information to people who desperately need it. Florida has one of the highest numbers of uninsured Americans in the country. And clearly people are eager for information and welcome the opportunity to make some choices for themselves and their families that they've never had before.
In fact, I had one report yesterday that a local enrollment fair at a church, they signed up 50 individuals on Sunday. And then I have this email from the Tampa Family Health Centers, but 2 stories. Juana Rodriguez, a 63-year-old woman who has been without health insurance for 3 years, stated, "What a blessing to finally have insurance." She said this with a smile and replied how she was able to finally afford her medications for pre-existing conditions. Her tax credit is $530, and she purchased insurance for just $35 a month. And then Robert Welch, a 29-year-old single young man who had no insurance for the past few years. He works for a small business, and his employer was not able to afford private insurance. He was able to get a tax credit for $2,200, and his premium is $28. He was extremely pleased and agreed to share his story, but he said he was too shy to speak in public. So Robert, we're sharing your story today, and I'm grateful that now we can replicate these good news stories, but we have a long way to go. Now, on his small business question, we're all a little bit disappointed that the shop, the small business website, is not going to be up and running as early as we would have liked. But does that affect the tax credits that are available for small business owners, those tax credits that encourage small businesses to provide health insurance or to help make it more affordable for their employees?
No, Congresswoman, it will not impact that. As you know, we had earlier suggested that at the federal level, and this is different in some of the states, but at the federal level, year one, we would not be able to aggregate premiums and give employees of businesses under 50 a choice. That will happen in 2014. The tax credits are very much in place. We have, again, a process where we're working with agents and brokers, which is the way that small business owners have gotten coverage traditionally.
And they're accountants, because some are not very sophisticated. They're 3 or 4 employees, especially in a tourism-fueled state, or a lot of restaurant owners.
But the tax credit this year will go to a 50% tax credit for eligible employers. It's a tax credit that did not exist before the Affordable Care Act. It's been at 35%, it rises to 50%, and we will absolutely be enrolling. We have thousands of applications for SHOP. We are working to get folks enrolled, and SHOP is different than the individual market, where business owners have a 12-month enrollment period because of the timing of plans. So SHOP owners or small business owners will be able to enroll each and every month as their employee insurance comes up for renewal.
Okay, and then they file for the tax credit when they file for their
That's
taxes.
correct. In 2015, they would be eligible
So
for
planning now, if you're a small business owner looking into that, because I don't think that many small businesses understand this very robust tax credit that's growing from 35% to 50% might make a huge difference.
And the Small Business Administration has been a terrific partner in that effort. They're using their channels to do a lot of outreach and education.
Thank you, Madam Secretary. The chair now recognizes the gentleman from New Jersey, Mr. Lance, 5 minutes for question.
Thank you very much, Mr. Chairman. A good morning to you, Madam Secretary.
Good morning.
My questioning will be in 2 parts. First, regarding the rule of law, and second, regarding the Medicaid expansion. Regarding the rule of law, I will be going into an exchange. That's how I read the statute, even though I didn't vote for it, and hope that it's replaced. And those who work with me in our office will be going into the exchange. And I would urge other members, for example, Senator Reid, that as I read the statute, that is the rule of law. In answer to Ranking Member Waxman, you indicated, and I certainly agree with this, that the President decided on the transition policy, even though the statute, as I read it, has requirements that begin on January 1st, 2014. From your perspective, Madam Secretary, what is the statutory authority for the President to have announced the transition policy?
Sir, I think the statutory authority is the enforcement discretion which is available under the law to us, and the President has asked us to use our enforcement discretion to not pursue penalties against insurers who would voluntarily decide to allow a transition of individuals in a market plan to continue in that market plan. This defers to state regulators. They get the first call because they regulate the marketplace, and then insurers, there is no mandate to insurers, it's voluntary, but it allows them to take up this option.
Thank you. So from your perspective, the ability of the President to do that is based upon enforcement discretion. I respectfully disagree with that. Thank you for answering the question. Number two, and Mr. Barton did raise this, as I read the statute, there are subsidies for state exchanges, but not subsidies for the federal exchange, and I presume that that was placed into the statute to encourage states to have their own exchanges, a carrot and stick approach. From your perspective, Madam Secretary, what is the statutory authority for permitting subsidies for the federal exchange?
Again, sir, I am not a lawyer, and I would defer to the Department of Justice for the statutory authority. I think the framework is that I am mandated by statute to pay the subsidies, and that I think the interpretation is both by the OMB, which is sort of the appropriation leader on this, and the Department of Justice, that the authority is consented to, even though it's not explicitly spelled out. But again, I'm not the lawyer. I would defer to them.
Thank you. Let me state, it is my legal position that the courts will rule against the administration in this regard, and obviously this is now before the courts. In the 3.5 years since the ACA's passage, has the President ever proposed a legislative change to any aspect of the law?
Sir, I'm trying to refresh my memory. I cannot answer that question, but I will certainly come back with an answer.
Certainly. It's my understanding that the President has never asked for any statutory change whatever, and he has made these...
I can tell you one that I do recall that I think has been in his proposals. We do have a provision involving state waivers of Medicaid expansion and then into the marketplace that is timed to start at 2017. He has suggested, and I think it's part of our budget proposal, that that date be accelerated so states would have full authority. There are other provisions, I think, in our budget plan, not necessarily pieces of legislation, but coming through that way that we could get you enumerated.
Thank you. And then finally, regarding the Medicaid matter, I have great concerns that many who have signed regarding Medicaid expansion were eligible before, and I know you're not able to provide those figures today, but I would like at an opportunity that is convenient for you, Madam Secretary, to have those figures, because it's my belief that quite a few were already Medicaid eligible and are not based upon the new law.
Gentleman, time's expired. Chair now recognizes the gentleman from Maryland, Mr. Sarbanes, 5 minutes.
Thank you, Mr. Chairman. Thank you, Madam Secretary, for being here. You've been very stoic in the face of a lot of adversity over the last few weeks. You've accepted responsibility for what you yourself characterize as a failure in the launch of the website, but have obviously been aggressive in trying to improve the situation. The evidence that you presented today suggests that things are on the mend, and a lot more Americans are being able to access the government website, which is the portal to affordable health care for them. I think if you step back, the bigger story here is just there were previously millions of Americans who were essentially trapped in a world where they could not access health care. There was literally no options available to them. If they had a pre-existing condition, even the substandard plans that were offered in the individual market often did not provide any option for them. So they didn't even have the opportunity to complain or face the challenges that now some of them are facing. But the fact that they are trying to access an option of affordable care, and yes, encountering some difficulties and having to push through those, etc. Even that is progress, because before they didn't even have that chance. And I think it's important for us to keep that in perspective. And that's why I think you said earlier, I heard someone say that, or maybe it was Chairman Waxman, that one of the common emotional responses for people when they actually can enroll is they break down in tears, because there are years of pent-up frustration and not being able to access affordable care.
Well, Congressman, we know that, again, in the individual market, which is the market that the new marketplaces are addressing, a large number, national studies show that it could be as many as 25% of people who tried to buy a plan were turned down totally. No
Right.
plan at no price.
Right.
And then you have people who were individually medically underwritten, virtually everyone in the marketplace. And that is very beneficial if you're healthy and don't have any likelihood of a pre-existing condition, and typically if you're male. It's not very beneficial if you're not. And if you get sick along the way, or if you're diagnosed, you could be, again, medically underwritten going forward to eliminate the condition that you need the care for. So
Right.
the choices were somewhat limited to a lot of people.
The promise of this is to create a new normal for the American people, where the option of getting health care is real. And that wasn't the way it was before for tens of millions of Americans.
Depending on where they worked. If
Yeah,
you work
exactly.
for a company, and the vast majority of large employers offer,
Then you had the access.
and you weren't medically underwritten, and you weren't penalized based on age, you were in as long as your employment. But if you worked for yourself, if you were an entrepreneur, if you were a service worker and didn't have affordable coverage, your options were greatly
But even that system is going to be more rational going forward, because as you eliminate discrimination based on pre-existing conditions, you address the problems with portability that we saw before when somebody leaves one employer and goes to the next. Those are all fixes that are going to improve the employer-based system as well. In terms of the challenges, obviously the launch of the website was much more difficult than was expected. But there were always going to be challenges. There's going to be new challenges. There are things, you know, you look around the corner, there's going to be difficulties and challenges associated with some of the payment issues that are going to happen down the line. These were always going to be there. There were always going to be difficulties. This is a major, major structural change to the healthcare system, which is going to improve it eventually, but we had to anticipate there were going to be difficulties, and we got to soldier through those. That's the American ethic, right? Is you take challenges and you overcome them. And then the last comment I just wanted to make is I think one of the issues is that a lot of the people who are coming and finding new plans, and maybe they have to pay a little bit more, or maybe the deductible is higher in some instances, for example. But what they don't compare it against is the exposure they had under the old plan that maybe they never had the occasion to experience. And so that's the apples to apples.
The gentleman's
comparison
time has
that we have.
expired. We have
Thank you.
15 minutes left. We've got 7 members still to ask questions. We'll go to 2 minutes per member. Chair recognizes Dr. Cassidy from Louisiana for 2 minutes for questions.
Hey, thank you, Mr. Secretary, Madam Secretary. I'm sorry. In your answer to Mr. Shimkus, did you really mean to say that the Affordable Care Act has not resulted in increased premiums for the non-subsidized?
Sir, what I said is preventive care.
No, are premiums
doesn't add
higher?
to the cost of premiums overall in terms of the
So
long-term health costs.
you're ascribing
That's
it to the
our description was.
You're ascribing it to the preventive health care aspect. Okay.
That's what he asked me. That's what I answered.
Now, Jonathan Gruber, one of the architects of this bill, has said that this bill is basically income redistribution. Now, obviously, there are the taxes that are $1 trillion over 10 years, but there's also the increased premiums that people are paying for their policies if they're not subsidized. Do you have an estimate of how much increased, what is the amount of increased taxes people, increased premiums people are paying to subsidize others on the exchange?
No, sir, I don't, and I think you can only talk about increased premiums, and I think Dr. Gruber would be one to suggest this if you compare like benefits to like benefits.
So let me go on. Danny from Baton Rouge is losing his coverage. He says that this is my apocalypse now. The company I have, my family coverage went up 371%. Monthly premiums for a family of 4 from $245 a month to $913 with a $4,000 deductible. Wow, I think Danny would like to choose his benefits as opposed to that. Many small businesses, according to your office, are going to lose their benefits. As many as 66% of employers, according to your analysis, will lose their grandfathered status. Do you think administration would support my Employee Health Care Protection Act, which would allow workers to keep their group health care plan they have now in 2014 and beyond?
Sir, as you know, the snapshot is not our office estimating anything. It was a description of the turnover that existed prior to 2010 in the individual and small group market, those statistics that you cited. And I think in, again, the small group market, there are lots of plans that are grandfathered. There are other plans that are offering transition and early renewals, and we're watching that every day.
Thank you. But could I get an answer to my question? Will the administration approve the same law that's given for the individual, that if a small business wishes to keep their policy, they would be allowed to do so?
The President's suggestion about a transitional policy applies to both the individual and the small group.
Beyond 2014?
Gentleman's time has expired. Chair recognizes Mr. Engel from New York, 2 minutes for questions.
Thank you, Mr. Chairman. I just want to say that New York is a good example of what's possible when the federal government has a willing and enthusiastic partner in ACA implementation. We've set up our own exchange. We have hospitals participating in the various delivery system reforms. Our Medicaid program is expanding. States that have fought to make the law work for their citizens, like New York, are finding success. Secretary Sebelius, I'd like to know what your experience has been in states that have obstructed efforts, mainly Republican governors, to implement the ACA compared to states that have adopted all of its measures. Are Americans experiencing an easier time obtaining affordable health care coverage in states that have their own exchange? And has the refusal of some states to expand Medicaid affected the rollout?
Well, I think that, Congressman, what we're seeing every day is governors actually considering the Medicaid expansion. Some, as you say, in New York, California, others adopted very early on. We were pleased yesterday that the governor of Iowa indicated an interest in moving ahead on Medicaid expansion. That was not certain. The governor of Pennsylvania is recently also indicated his interest in doing the same. So we're working actively with states around the country. I think it is enormously difficult for consumers in states where there is no Medicaid expansion. They hear about the opportunity for affordable health coverage only to find out that they earn too less to qualify for a tax credit in the marketplace, and really they have no viable option at all. And that, I'm told by our navigators on the ground, our assisters, the people in community health centers, is one of the worst conversations that they can have in this period.
Well, we spoke with the governor of Kentucky the other day, and he explained to us Kentucky, generally a Republican state, where it's working really, really well, where you have a governor who's a partner who wants to see it work. It can work, and it should work, and I hope that more governors would continue to do what's in the best interest of their constituents rather than playing political games. Thank you.
Chair, thanks, gentlemen. Now recognize the gentleman from Kentucky, Mr. Guthrie.
Thank you. So just mentioned Kentucky. You know, 80% of the people signing up on our exchanges are Medicaid. And that's been a concern of mine. I was in state government before. And Medicaid, as a national program, has 72 million people, and we're expecting an increase of 25 million over the next 10 years. And I do believe Medicaid is important for low-income children, disabled seniors, that it was designed for. But do you believe that Medicaid should be a program of last resort, or it's become just its own insurance program as it is now?
Sir, first of all, I think the enrollment numbers are about 51 million, not 72. But also, Medicaid has played, I think, a critical role for lower-income Americans, not only offering wide range of health benefits, but at a lower cost per capita than private insurance and that Medicare.
And I actually don't want to be rude with this, but I've only got, they cut us down to a couple of minutes. But so the question I want to get at, though, your department has estimated that about 5 million Americans who previously purchased insurance through their employer will move to Medicaid. And that's from the Office of OACT, the Office of Actuary. It's a number we got. And are you familiar with that we're looking at, over the next 4 years, estimates that 5 million Americans who have employer-based insurance will move to Medicaid?
I'm not aware of that. The Office of Actuary is really an independent, but I can check that out. I'm not familiar with that specific number.
You know, that's just a concern because the estimate is it'd be $20 billion in this group of people who previously purchased health insurance through their employer, but will be moving to Medicaid because of the Affordable Care Act. The question that Chairman Upton had about income, there's a question with Chairman Upton about income verification and residency verification. I know that's up to the states to do, but the states that don't expand Medicaid, the information right now, it's just like trust the federal government's numbers, right? Right now, that's what they're being asked
Again,
to do
sir,
right now.
we don't enroll anyone in Medicaid. What we do is look at income eligibility and, based on the state law, send that individual's name and the information that has been collected to the state. The state actually is the connection between the individual and Medicaid.
But because of timing, by the January 1st, they're going to have to just accept.
Yeah, and that's going on that's going on right now, the process. But we don't enroll in Medicaid. We just
but they have to take your
Gentleman's
data.
Time's expired. Thank you, Madam Secretary. Chair recognizes Mr. Griffith. 2 minutes for question.
Thank you, Mr. Chairman. Secretary Sebelius, let me just let you know that I agree with Representative Leonard Lance's legal reasoning on the matters that he brought up earlier in his testimony. I do find it interesting that when we're listening to my colleagues on the other side of the aisle, that they talk about scare tactics. This is similar to what they said back in the summer and in September when we were holding hearings because we were hearing that the plan wouldn't be ready on October 1. And so I'm just concerned that we're going to have some of that same kind of thing now that we're being attacked for asking questions. We're just trying to get the information. And it's not that we're interested in scare tactics or witch hunts. It's a matter of we're trying to get to the bottom of a lot of these problems that we're concerned about out there. And obviously, one of the tactics, they said, well, this is all just political, but you certainly have accepted responsibility, and you don't believe that we caused the problems with the website, therefore making the public distrust it. Isn't that correct?
I do not believe you caused the problem with the website, sir.
Some of my colleagues have implied, maybe not that, but that somehow we're responsible for all that distrust out there, and I don't think that's accurate. Also, I don't believe that the federal employee health benefit plan is a skimpy plan. Some of the folks said that the reason that costs were going up is that people had skimpy plans. Well, I was previously on the federal employee health benefit plan, and my family's facing 117% increase out of our pocket. That's out of our pocket increase to go onto the exchange here in D.C. And so you don't think the plan you have is skimpy, do you?
No, sir, I don't. But as you know,
the
new marketplace plan have some age rating that the federal employee health benefit program did not. So you're going to see younger employees
And that's one of the
paying a
reasons
lot less
why.
and
All right,
older
I'm running out of
employees
time.
paying more.
Let me say this too in regard to Medicaid. One of the problems that you're having is you're sending people to the states based on income alone. And in Virginia, in most states, they have a asset amount. In Virginia, it's only $2,000. So they may have sufficient income or they may not have enough income, but they qualify for Medicaid under income. But they don't qualify for Medicaid because they own a house. And I asked some experts on this previously, and they said they have to choose whether they want their asset or whether they want the Medicaid.
Again, the state law and the state Medicaid enrollment officials will make the determination of whether that individual will be enrolled. When they present at the marketplace based on 133% or less, and in Virginia right now it would be based on a lot less because Virginia has not raised their Medicaid eligibility.
Thank you, Madam
We would make
Secretary.
the determination and refer that name.
Chair recognizes the gentleman from Georgia, Dr. Gingrey. 2 minutes.
Madam Secretary, I want to begin the question about the Medicaid program. My governor, Nathan Deal of Georgia, particularly wants an answer to this question. I'm sure all the other 49 governors would too. The American Affordable Care Act forced states to retain the eligibility requirements of Medicaid through the maintenance of effort provision going back, to 2009. With the expiration of these provisions, states will finally have the flexibility to tailor their Medicaid program to the best address the health care needs of their Medicaid populations. Now, this is the question. Will the Medicaid MOE, maintenance of effort, expire for all states beginning on January 1st, 2014?
Yes, sir.
Thank you. Madam Secretary, I want to ask you real quickly in regard to e-health plans. This company, California-based company, I think 10 years old. We talked about it earlier in the discussion. I think they spent about $100 million developing their program, allowing people to go onto their website and find plans. And yet we spent 7 times that much reinventing the wheel. Can you tell me why we didn't just use that technology or maybe some other Silicon Valley company to have a public-private partnership rather than starting over from scratch? And who made that decision?
Well, sir, I would tell you that while there are some comparisons with the e-health situation, there are a number of features very different in the federal website that were required. E-health doesn't determine citizenship eligibility. It doesn't
yes, but did you make that
did
you make that decision, or was that made by someone else?
What decision, sir?
The decision to start over from scratch.
Well, I don't think they did start over from scratch. They actually, I think along the way, adopted a number of the known technologies that were in place.
Well, let me ask you finally, as I run out of time, how many times did you actually visit with the President since 2009 or 2010 when you came on board? How many personal visits did you have with him at the White House regarding the Affordable Care Act?
A lot.
Thank you.
Can you verify that?
The gentleman's time's expired. The chair now recognizes the gentleman from Florida, Mr. Bilirakis. 2 minutes for question.
Thank you, Mr. Chairman. I appreciate it. Thanks for holding this hearing. Madam Secretary, in November, in a proposed rule in November, CMS announced that they were considering increasing payments to insurance companies with sicker than average customers through the Risk Corridor program under Section 1342 of the ACA. This program is supposed to be financed by insurance companies participating in the exchange, but the proposal appears to put taxpayers on the hook. Specifically, the rule states that, and I quote, "This proposed adjustment may increase the total amount of risk corridor payments that the federal government reduce the amount of risk corridor receipts." Did you, Madam Secretary, estimate how much more money taxpayers would have to pay to insurance companies under this proposed rule?
Sir, the risk corridor has always been a part of the Affordable Care Act and was anticipated for the first couple of years to be used for reinsurance and risk corridors for the new marketplaces. So we did put out a proposed rule. We talked about the fact that we would look carefully at what the enrollment is at the end of 2014
but I'd like
in order to determine going
Madam
forward.
Secretary. Did you estimate how much money?
We won't know anything about what that risk corridor looks like until we get more enrollment.
Okay, well, the rule says and I quote, "We cannot estimate the magnitude of this impact on aggregate risk corridors, payments, and charges at this time." I'd like to get to the next question. Do you think it's responsible to put taxpayers on the hook for insurance companies' losses in the exchange? Do you think it is responsible to make these payments without even estimating the cost?
Again, sir, it will be based on what the risk pool looks like. We always knew that in the first couple of years, the market would be attracting some customers and not attracting others, and that there would be some risk. And what we are hopeful for as the Affordable Care Act continues into maturity is that we have mature pools. We knew the first years would need this.
Chair thanks the gentlelady, and now recognize Ms. Elmers. 2 minutes for questions.
Thank you, Mr. Chairman. Thank you, Madam Secretary, for being with us. I have some specific questions to ask about some of the, essentially the promises that the President made to the American people as he was rolling out the idea of the Affordable Care Act. One of those promises being, if you like your doctor, you can keep your doctor, period. Can you commit to the American people today that this is true and that they will be able to keep their doctor?
Congresswoman, I think that, as you well know, in the private market, networks change on a constant basis. The President is not overtaking the private health insurance market. There is nothing in the
You are absolutely right,
Act
but that is
would
the
cause
promise,
a person to lose a doctor.
the promise that was made to the American people so that this piece of legislation, which is now law, was passed, was that they would be able to keep their doctor.
Again,
yes or
most
no?
consumers will have the opportunity to pick and choose a network that continues their doctor. There's nothing in the law that has their doctor lost to them.
There is nothing in the law, but there are networks that are now very narrowed as a result of the law. Is that not true? There are medical
Insurance
centers.
companies make network decisions day in and day out.
But that was
Any
not that is
company-
not the promise that the President made. Did the President not make that promise to the American people?
This is the private insurance market that changes networks on basically a daily basis.
Then why in the world, Madam Secretary, did the President make that promise to the American people?
I think the President was trying to assure people that the law did not require them to lose their doctor. They have a network.
No, I don't believe that he was reassuring the American people that they would lose their doctor. I think he was reassuring the American people that if this law passed, that they would be able to keep their doctor. So therefore, today you are basically saying no, that this is not the case.
I'm saying that there is, again, this is the private insurance market where insurance companies develop networks and change them on a regular basis.
And the American people will be able to keep their doctor if they pay more, according to Ezekiel Emanuel.
They can choose a network where their doctor is available. They can choose a plan where their doctor is not available based on the kind of premium, the kind of deductible, the kind of situation.
Well, I see that my time
has
expired, so thank you, Madam Secretary.
The Chair thanks the gentlelady. That concludes our questioning at the present. Madam Secretary, we will have some follow-up questions we'll send to you. We ask that you please respond promptly. We have a couple of unanimous consent requests. I'd like unanimous consent to submit to the record a letter from Dr. Julie Welch, an emergency medicine physician and educator from Indianapolis. Without objection, so ordered. Dr. Burgess.
Thank you, Mr. Chairman. Dr. Gingrey referenced an offer from eHealth to the President to provide a platform for the market exchange, and I would like to submit his letter for the record, and I will make this part of a question for the record that I'll do in follow-up.
Without objection, so ordered. Ranking member has unanimous consent request.
One is from my constituent in Piscataway, Anthony Wheel, that I referenced. Another is the one that Ms. Schakowsky referenced. You know, these are the different individuals impacted by the ACA.
Without objection.
And then there's a third one. Is that from Jan also? From Ms. Schakowsky.
Without objection, so ordered. Thank you, Madam Secretary, for your patience, for responding to all of our questions. I remind members they have 10 business days to submit questions for the record, and that means they should submit their questions by the close of business on Tuesday, December 31st. Another important hearing. Thank you, Madam Secretary, for your indulgence with that. Without objection, the subcommittee is adjourned.